Madam Chair, I do have a handout, if that's okay.
I'll have the secretary grab it.
Thank you so much. My name is Leigh Ann Downey Economy, DOWNIE hyphen ECONOMY, and I'm the director of Growing Roots Early Learning Center. We are one of the largest licensed childcare centers in Flathead County with programs in Kalispell and Summers. I'm here today representing a group called Circle Time. We are childcare providers that meet bi-weekly to get organized as advocates for a strong childcare system in the state. Circle Time includes 72 childcare professionals from licensed family, group, and centers from 21 counties throughout the state of Montana. I'm here to talk about Montana Access to Quality Child Care System, or MAQCS, which is the new management system for child care licensing and the Family Subsidy Best Beginning Scholarship. The new MAQCS system was rolled out very quickly and with very little communication or training, causing significant impact on child care centers in Montana. Earlier this spring, Circle Time members sent a letter to DPHHS administrators about the problems providers were having with MAQCS, but did not receive a reply. Recently, Circle Time reached out to other providers across the state to get feedback regarding the program. I wanted to come and share some of what we learned. Many providers serve high numbers of children who receive Best Beginning scholarships, which means these payments are the main source of revenue for these programs. These payments are now taking weeks or even months to process, and many providers are unable to make payroll deadlines for their employees and pay their expenses. We spoke with one provider who had to take out a loan just to pay her staff since payments were so delayed. Providers report tens of thousands of dollars of outstanding payments. When providers are unable to pay their rent or mortgage and cannot keep up with payroll, they close their doors, which leaves parents without care and unable to go to work. Circle Time also heard about, and I've experienced this myself, how long it is taking to process licensing situations, such as new employee approvals and license renewals. Providers who want to expand are unable to bring in new enrollments until employees have been approved by the state. When this process is taking weeks, potential staff look elsewhere for work, and providers are unable to fill their slots. Even with submitting licensing renewal paperwork 60 days in advance, the processing of documents in Helena can't keep up with the demand. Keeping licenses active at all times is not only our legal obligation, but it also ensures our Best Beginnings payments are available. Some of the new policies implemented with MAQCS leave families unable to pay for care, like when they use more than one provider within a month, or when school-age children attend full-time during school vacations. As you can see, child care programs and families are suffering across the state with this new system. As we all know, child care is not just a family issue, it's a workforce issue that affects every aspect of our state's economy. We asked the Department of Health and Human Services to set up a backup method for payments to prevent delays, to revisit new policies that are less family-friendly than in the past, and to train providers when new systems and policies are introduced that provide robust technical assistance during the transition. We have confidence you'll help us resolve some of these issues promptly. Thank you for your time.
Thank you, Ms. Downey Economy. Next testimony, please.
Hello, Madam Chair and Committee. My name is Sarah Mitchell, MITCHELL, and I'm just echoing here as an early childhood educator what Ms. Downey just shared with you. I would like to submit and to hand to the Secretary, please, to hand out the MAQCS letter that we did send to the state, and as of today have received no response.
Thank you, Ms. Mitchell.
It's a question, I guess I'm just following up with Representative Howe on the speaker on the child care. I don't want to put you on the spot, but you had seen the document on that and you heard a little bit of testimony. Just the opportunity, if you wanted to talk on it. A lot of providers are from Billings who also brought it up. And I appreciate giving you the opportunity if you wanted to share anything about that.
Madam Chair, members of the committee, if I could invite the administrator for Early Childhood Services Division to provide comment.
Please, thank you.
Tracy Moseman. Oh, she's online.
Ms.
If
Moseman?
she can be promoted.
Good morning, Madam Chair, members of the committee. And I am the administrator here for the Early Childhood and Family Support Division within DPHHS. And with your permission, Madam Chair, I will give a bit of context and history on this project as there has been some public comment today.
Yes, please.
In 2021, there was a Legislative Audit Division audit that determined that the previous system called CUBS had reached its end of life, and the agency needed to determine if the return on investment for continued support of that system was appropriate. So following that audit, the department did begin the process to replace CUBS with a new childcare licensing and payment processing system for Best Beginnings. MAQCS was launched in February of 2026. DPHHS proactively prepared providers for this transition by sending multiple communications between January and early March via both mail and email. In addition, the department contractors, known by some as our CCR&Rs, did utilize and continue to utilize frequent social media posts to keep providers updated on changes. We continue to offer ongoing support through a fully staffed help desk, and our dedicated Best Beginnings at mt.gov webpage features helpful resources and training videos. We do acknowledge that there are implementation issues with the launch of a new IT system. Our team and our IT vendor meet regularly to address these issues and make fixes to the system. To our knowledge, the statements that there are widespread issues with payments are not corroborated with our payment history data coming out of MAQCS. People with individual cases are being served through our help desk process. Since the new platform launched, thousands of payments have been successfully issued, totaling over $11 million. In addition, the program is now serving more Best Beginnings scholarship children, with an increase in the number of children receiving these scholarships growing from December of 25 to March of 26. Statements that families are at risk of losing services due to this new system don't appear to be validated through this data. The platform is successfully processing millions of dollars in payments each month, and while anomalies continue, our staff is actively and successfully working to resolve individual user cases. Currently, we are processing provider payments more efficiently than the federally required 21-day time period for timely payments. We're dispersing funds within that 21-day time period when we have timely, error-free invoices submitted by the providers. For example, payments for May services were made as early as June 12th. While necessary internal checks, such as allowing families time to review the invoices, have added a few days to the payment processing timeline, these new steps are essential to ensure a secure and accurate process that protects against fraud, waste, and abuse. Some claims, like the number of providers impacted by system issues, are subjective because many payments have been impacted due to lack of completed steps on the provider side of billing the department. These issues could include things like the provider not creating a new account in MAQCS, the department not having an accurate email address on file for the provider not submitting accurate attendance records, and different banks have different processing timelines that have impacted the length of time for payments to be received in a provider's account. I will note that at one point in time in March, we had over 100 providers who had not yet logged into the new system to create an account to be able to bill for their Best Beginnings payments. 0 to 5 is under contract with the department to provide free business support to childcare businesses. We continue to encourage any provider with concerns about cash flow due to the payment processing timeline for Best Beginnings to reach out to 0 to 5 for technical assistance with business strategies. Our team does continue to be committed to supporting these childcare providers with delivering excellent customer service as we transition to this system, and continue to provide updates on our Best Beginnings website as new functionality and new issues are identified. And with that, I would be happy to stand for any follow-up questions.
Thank you, Ms. Moseman.
Okay.
Good afternoon, Madam Chair, members of the committee. My name is Sarah Mitchell, MITCHELL, and I am an early childhood educator here in Helena and a member of the Circle Time Group, which represents more than 70 childcare providers across 21 counties in Montana. First, I want to thank you for receiving public comment after what I know has been a long day, and for taking the time to listen to the concerns shared earlier this morning regarding the MAQCS system. I want to take a moment this afternoon to respond to some of the information provided this morning by the department's representative. While our Circle Time Group understands that implementing any new system will inevitably involve challenges, the issues providers are experiencing are widespread, significant, and well beyond typical startup bugs or user error. Providers have encountered hardships not only with scholarship payments, but also with licensing renewals and new staff hire requirements, creating delays that affect daily operations, staffing, and the ability to continue providing care. In some cases, providers have experienced substantial payment delays, including one provider waiting for $70,000 per month in payment for services rendered. Her outstanding invoices to the state now exceed $200,000. These situations place providers in the difficult position of deciding whether they can continue enrolling children who use the Best Beginning Scholarship Program, and for some, whether they can remain open at all. Our intent in bringing these concerns forward is not just to complain, but to ask for collaborative problem solving. Childcare providers want to work alongside the department to ensure the system functions as intended, so families continue to have reliable access to care. We know that meaningful collaboration between providers, the department, and policymakers leads to stronger solutions, better implementation, and ultimately better outcomes for Montana's children and families. We respectfully ask the committee to continue to explore these issues and to help ensure they receive the attention needed so that providers, families, and the department can move forward together with a system that works as intended. Thank you for your time and consideration.
Thank you, Ms. Mitchell. Any further comment in the room?
The comments that we heard about the MAQCS childcare payment reimbursement system, I feel I've had some constituent comments about this as well, and I appreciate the department having Ms. Moseman online to I guess respond, but I still feel fairly concerned about this. This seems like a pretty serious issue and an ongoing issue. And I think that if the department is not getting those reimbursements processed in a timely fashion, putting small business owners at serious risk. And then, of course, that impact for families and for employees and employers, I mean, that just seems like something worth digging in. So I was wondering if we could send a request to the department that they come prepared in September to include this discussion as part of their updates to us. And hopefully, we can hear from them that they've been working with childcare providers and reaching hopefully some solutions. But just want to ask if we can specifically ask them to address that, come prepared in September to address that, and with luck, share some progress.
Any thoughts from the committee on that? Senator Asp?
Madam Chair, I think that would be fine. I think the other thing, this morning they talked about 100 plus providers that hadn't done their part of joining the system, signing in and being ready to accept payments and stuff through the system and bill through the system. And that was in March. It'd be interesting to know if they have numbers for June 30th. And they maybe can tell us that tomorrow for all I know. But if there's still 100 plus providers out there that haven't done their part, we need to figure out how to get them to do that. And then, Madam Chair, just anecdotally, I will say that there's a provider in a community that I represent that just bought several lots in town and is planning on building a new daycare center there. So that it must be working well for them because they're looking at expanding.
Vice Chair Howe?
Thank you, Madam Chair. Well, I wonder actually if I could ask a question of Ms. Mitchell about, since we have a provider here, would love to hear if you have any response to what the department had said earlier about problems with providers signing in and accessing the system, just so that we're hearing both sides of that.
Yeah, so first, I think they need to clarify what they're saying a provider is, because it could be the actual childcare staff provider. That's a new requirement. So teachers, anybody that is providing direct care has to have an account with the MAQCS system. So they're asking providers to get on, and she mentioned email issues. Some of these providers don't know. They have several. They may have personal email that they have connected with the state, or they may have actually used their business's email. Providers were not sent the email to say use this email, so it's a guessing game. So those are errors and delays. So I think they need to clarify if it's directors or actual providers, because that 100 really is small in comparison if you're looking at all direct care staff that are accessing that account, if that makes sense. Additional issues, there are delays with the ticketing system. So that is what she was referring to, that responsiveness. I've had tickets that closed on me without any solution, and I don't know why. So I think that's an issue. There are bugs that are limiting providers with going completely through the licensing process to renew, and there's no backup system. There's no backup way for them to be able to even go back paper-based form. That was not built in. So providers are literally on pause, even with just renewing their license. So those are just some small issues. We as the Circle Time group did reach out, and we did a calling tree with providers throughout the state to gather information further connected to their hardships that they're also experiencing. And it's similar, but then there's also just wide range. And we know it's a new system, right? There's going to be all these gray issues that weren't accounted for. But I think for us, it's us mentioning that there are issues and then not getting a response and feeling like we're not counted in collaboration with all of these.
Quick follow-up, Madam Chair. Thank you. Thank you, Ms. Mitchell. That's helpful. And what kind of like training and technical assistance is the department offering for providers to get up and running with this new system?
So when I first got the email for access to a training, it was a video that told me how to log in. So when you're talking about two systems coming together, because they combined licensing with CUBS, the best beginning. So those are two separate systems they put into one. Makes sense. It's easier to access. The issue, though, is with the training, we didn't receive a robust in-person or online virtual training where providers would have been given the opportunity to ask questions or to see somebody even navigating the system with clicks. I will say there have been other departments that have provided us with that type of training, and it's invaluable because we can see for real time how they're navigating the system. And sometimes, too, they'll discover the bugs themselves when they're clicking through. It's a huge system, and I can't imagine the undertaking it took, again, to combine two very vast systems, but the training on it was, to me, very limited. And I would have preferred in person than clicking through a video.
Okay, thank you. That's helpful. Well, Madam Chair, I'll just reflect this morning, the department came and gave us the sort of click-through demonstration on the Medicaid side of what their CE determination system would look like. I think something like that for providers is probably within the scope of what the department could provide, and sounds like it would be really useful just in getting folks together and addressing some of these. So anyway, I find that helpful. I still would love to just, again, ask the department to come in September prepared to include this in their updates.
Everybody on the committee, anybody object to that? Okay, I think that's fine. Miss Allen, did you catch all that? I'm sure you did, but okay, excellent. And then let's see,